get started. Filling your bucket. So, and it's about spreading happiness and joy at your school district. Um, as I already stated, being happy can make you healthier. There's studies that support the idea that people that are happier, people that carry a happier mood, are more active. They're more likely to engage in health promoting activities. They sleep better and they cultivate better relationships. And that's just intuitive. I don't need to pull up a research study to make you believe that. It lowers your cortisol. You have less inflammation in your body. If you have lower cortisol, you have less inflammation. Your body is more resilient to sickness and disease. And I'm just thinking about right now, there's so many people that are coming down with things. And even myself, I woke up this morning with a little sore throat, but I'm trying to stay happy. And it's not only about me being happy, but affecting the culture and the environment around me. So today I want to tell you about, first I'm going to start off with MESSA benefits. MESSA benefits can make you happy. I want you to know what you have available to you and your dependents. After that, we'll talk about how you can put together a MESSA Worksite Wellness Program. And if everyone doesn't have MESSA in your district, if you're concerned, oh, everybody, all our members don't have MESSA, don't worry. We create programs that are all inclusive. So we don't like to exclude anyone. So we'll talk about benefits, we'll share about resources, and then we'll build a worksite wellness program. Number one thing, we have a member service department that you can talk to live. I know there's so many robots around right now, artificial intelligence, but when you call our member support program, that 1-800 number, you usually can talk to someone in person live. The wait is short, and they can help you right away. If you prefer, you can call our MESSA field representatives. Everybody here has a field rep in your area. Here are their pretty faces on the screen, so you can identify your MESSA field rep in your area. So if you have questions about your benefits, any part of your benefits, about open enrollment, I know a lot of people are having open enrollment right now. Our MESSA field rep is available for you. When you go on the website, you can locate this landing page, and when you click on the number, their contact information comes up. So you can call them or email them with questions. Has anybody heard of Teledoc? Put it in the chat for me. Michelle, yes, good. Teledoc. Now, we've always, for the last couple of years, we've always had what I call the Jetsons. We've had an option where if you're sick and it's not anything emergent, you can go to the urgent care virtually, right? Well, I believe it was maybe a year ago we brought on Teledoc, and Teledoc is more expansive. Not only do you have urgent care available to you, but now you can get primary care services virtually. So the 24/7 urgent care, virtual primary care. So that means your annual wellness visit, and you can establish a primary care physician, as well as mental health care, all through Teledoc. Now, you first must register. You can go to Teledoc on the mesa.org page to register. They're probably putting that in the chat right now. Or if you are a MESSA member, you've probably received emails from MESSA or Teledoc with access to a place to register. So check that out. So 24/7 urgent care. What type of things go through 24/7 urgent care? The sore throat, the sinusitis, all those things that you might consider ER for, but you don't want to go to ER because there's very, very sick people and you don't want to sit in the waiting room. Those things that you might go to the area urgent care for. However, many of us live in rural areas and there are no urgent cares accessible or close. This might be your option. Or you're busy. you feel like you can't get away from your desk or your job and you want to run out in the car and talk to a doctor, you can do it through teledoc. There's also mental health care. So you can have access to a counselor, a psychotherapist, or a psychiatrist through teledoc. Okay. Now, additionally, there is chronic condition management. Once you register for teledoc, if you or one of your dependents, one of your family members are challenged with things like diabetes or hypertension or obesity or overweight conditions, they have these chronic condition management programs where you would work with a health coach. So if, let's say, the doctor has said things like, terms like metabolic syndrome. You've heard things like insulin resistance during your doctor's appointment or pre-diabetes. That will qualify you for the diabetes prevention program in this teledoc program. Okay. So you would, once you're registered, they may reach out to you, but you have an option to get in that program. And what they do is they help you understand the lifestyle behaviors that are necessary to prevent you from developing diabetes. And that's very important. So they will work with you on managing sleep, understanding the importance of sleep, nutrition, and movement, so you do not develop diabetes, or your family member, or if you already have diabetes, the diabetes management program. Again, a health coach works with you one-on-one. It's done digitally. Again, with hypertension, and we consider diabetes and hypertension, they're sibling conditions. Once you develop hypertension, you are more at risk for developing diabetes. Once you develop diabetes, you're more at risk for developing hypertension. So those are available. The weight management program, again, if your doctor has said things like your BMI is 25 or over, okay, or your doctor has talked to you or a family member about the need to manage your weight, this can be a support to you. I know a couple months ago, most insurance companies stopped paying for some of the obesity management drugs. This can help people manage that situation, motivation and guidance through what is necessary to manage your weight and lose weight. So very valuable programs for you and your family members. Hinge Health. I heard somebody, Kathy said, I am the evangelist for Hinge Health. And that I am. I love Hinge Health. I've worked with them. I'm working with them now. This is actually a virtual physical therapy program. Okay. So just like you go to outpatient physical therapy, you can use Hinge Health, a digital program, and get physical therapy virtually. I remember about 10 years ago when we started using, or you started hearing more about virtual care, like the urgent care. And I would laugh and say, eventually we're going to be doing physical therapy. It was a joke back then, but it's real. We're really the Jetsons right now. And it's very effective. I really enjoy Hinge Health. So once you register, again, you can go through our website. That's the best place to go, to MESSA, and they'll put it in the chat for you if you're interested, you or your family members. Now, I must say, Hinge Health is free. Teledoc is subject to your copay and deductible. Hinge Health is free. It doesn't affect your physical therapy sessions, okay? And you don't need a doctor's order. So if you are, I always laugh and say, if you're at the age where you wake up and you've injured your shoulder in your sleep and you need some help, some direction on flexibility exercises, mobility and strength exercises, Hinge Health would be the place to go. And not only shoulders, but hips and knees. Or if you are in that age range, ladies, where we call it menopause or midlife, and things are changing for you physically, your musculoskeletal system, they call it musculoskeletal syndrome. There are physical therapists that specialize in menopause support in Hinge Health. So pelvic health coaches, and one of them is going to come and talk to us today and tell us more about that. So I'm not going to get too much more into Hinge Health. I love it. You should check it out. And we have a speaker today that's going to talk about more of the benefits and some of the things, the utility of Hinge Health. And I'm trusting those that are overseeing the chat that there's no questions in there for me. Medical case management. How many in here have heard of medical case management? Tell me. Anybody? I love medical case management. I always slow down when I get to this, talking to members, because this is my first job with MESSA in 2003. I came from, and I am a registered nurse. I don't know if I mentioned that, but I worked as a medical case management nurse. I came from a company that did medical case management, a self-funded company. And the role as a medical case manager there was saving money for self-funded companies, because large cases would put a smaller company or organization out of business. So we used to seek out potential high cost cases, kind of red flag them. Totally the opposite when I got to MESSA. This service or resource is for members who are dealing with catastrophic diagnoses. Let me explain what catastrophic means here. A situation where you are requiring several providers. Perhaps you or your family member might need an endocrinologist, a neurologist, a rehab doctor. So and perhaps high cost medication, perhaps high cost durable medical equipment. Okay. For you as the caregiver, that can be overwhelming. You know, the healthcare system can be very complex nowadays. What we do as a medical case management, a resource, the medical case managers here at headquarters who are registered nurse, bachelor's prepared registered nurses with additional coursework and training in catastrophic and chronic diseases, what they do is they assign a nurse medical case manager that's in your area. So there's medical case managers all over Michigan. So they assign one to you and your family member, and they become your medical advocate. So they can do things like attend doctor's appointments. If your loved one is hospitalized for a serious condition, they can meet with you as well as the healthcare team and help discuss the host long-term possibilities. So as the expert in your area, they can help you decide which providers would be the best providers. You know, when you're in that area working, they can let you know, no, that you don't want to see them. You don't want to see that doctor. Perhaps this doctor has good references. And I'll give you a case in point or a scenario so you can really understand it. Let's say you or a family member had a stroke. And we know with the stroke, there may be paralysis, there may be speech loss, there may be vision loss. If you live in a two-story home, you might need a ramp to get in the house now or to your loved one. You may need a hospital bed on the first floor. You may need the bathroom doors widened. As a public school employee, that might not be your expertise and you're under stress. You might not be thinking that long term. This advocate would be thinking for you and arranging those services with the best providers in the area before your loved one gets out of the hospital while you're at work. So it's a great service. I consider it a wellness service because it lifts the burden for the caregiver. And being a caregiver can be very, very stressful. You're already a caregiver for our children, and then sometimes family members are in situations. So I consider this wellness. So as a part of wellness, and I'm gonna tell you how you can fit that into your wellness worksite wellness program. Let's keep going. Second MD, another service for you. Okay. Now you can go to another doctor and get a second opinion with your health plan now. You have that. It's subject to copay and deductibles. Okay. So if you're in a situation, you're going to you're dealing with a bunch of symptoms and your doctor doesn't seem to be giving you the answers you need and the support you need or the direction, you can get a second opinion. However, with Second MD, it's not subject to any copays or deductibles. This is free. And this is a panel of experts in the medical profession. Okay. So they've dealt with a lot of, I call them outlier type of symptoms. So they might be more familiar than your community family physician, right? They're exposed to different things. I liken it to going to the Cleveland Clinic or the Mayo Clinic. So these are experts. It's not subject to your copay or deductible, so it's free, that can help you make decisions about your situation. This is a very, very valuable benefit. Now, you would access this through our medical case management nurses. So you let them know, you notify them that you are interested in the Second MD, and they'll take your case from there. And I was just talking to one of the medical case management nurses the other day, and what they do is they might identify you as a medical case management case as well. So you're what do they call it? Killing two birds with one stone. Is that so you might get both services. So a very valuable. I dug into that. I wanted to hear more about that. I haven't used it, but I just think this is great. I liken it to going to the Mayo Clinic. You don't have to do all the traveling though, or the Cleveland Clinic. You get that type of elite specialist, and it's free. This is something your colleagues need to hear about. That's why you can put it in part of your worksite wellness program. And of course, we still have the nurse line. We've had the nurse line since I started and even before that. And, nurse lines are very prevalent in the healthcare community. Most doctors have that and a lot of other health plans, but we're still here with the nurse line. So that would be questions about medications. There's so many different supports we offer. So let's say you have questions about a medication, or even if you're questioning if you need to go to ER or urgent care, you can use the nurse line. I'm the nurse line at my family's. For my family, they call their daughter Rhonda. Ovia Health. We have a speaker today from Ovia Health. She's going to tell us more about that. I mentioned that earlier. Again, this is a wellness resource for you and your family. It doesn't exclude men. It's about family. So women and men. If you have questions about reproductive health, fertility, or menopause, so every stage, okay, there are educated professionals that can answer your question. Of course, you go to your doctor first. But a lot of people get on the internet and it's so much out there. This can help you or ensure that you're getting reliable, valid information. You don't have to go out there and do your own research. They have it there. Or you can get information from them and go out and do more research if you like. So support during that reproductive time when you're planning a family, fertility, you can have questions or issues, and menopausal support. Great program. So when you're talking about benefits with your association or your members, you're spreading the word. We're not excluding any health stage. Of course, our mental health benefits are comparable to our physical health benefits. Mental health is very important to us, and we want to make sure our members are supported and feel supported from their benefits. Our mental health supports our physical health. How you think in your mind goes straight to your body. My stress tools. It's been successful the last years we've had it. My Stress Tools is located in your My MESSA. So when you get on the website, you go into your account, mymesa.org. If you're on a computer doing it, it's up at the top on the right. You click on, and I think it says Health Other Resources. And what'll happen is My Stress Tools will appear, and it'll ask permission to take you to the site. My Stress Tools. As soon as you get to the site, your name will pop up. If you try to go through the internet, you won't be able to get on. So this is specifically for our MESSA member, okay? And what it is a suite of tools. And I love My Stress Tools. So if you are a person that likes videos, there's videos. If you like to listen to things, there's podcasts. If you like to be interactive, There are interactive coaching applications. For instance, there is a mindfulness coach program, 28-day mindfulness coach. You click on it, you do a 2-minute video for the next 28 days and learn about mindfulness. There is a resilience coach. There is a diet and nutrition coach. If you like listening to the top wellness gurus in the nation, they have podcasts talking about sleep, talking about happiness, any subject that you can think of in the wellness realm. It is on My Stress Tools. Check it out. Now, even if you're not interested in it, if you are a leader, an influencer in your circle, let's say you lead meetings, staff meetings, or association meetings, or parent groups. As a member, you can pull My Stress Tools up on the screen. Every time I'm out at a school, I see these screens up in the room. You can pull it up on the screen and say you want to do mindfulness, but you don't want to lead the mindfulness and you don't want to look it up. You just use My Stress Tools. Or as a group, you want to do a mindfulness challenge, and you meet every week. Pull that 2-minute video up and open your meeting with a mindfulness session, or do a video on emotional intelligence. Even I believe it's appropriate for some classrooms, but you would need to vet that, of course, and determine. I have a group in East Michigan that's using it for their parent groups. They do they have a coalition or organization where they bring parents in once a month, lunch in the evening, and this time they pulled up a video on emotional intelligence. So it can add to some of the curriculums you are developing for different people groups you have. Able to, another support we provide to support your mental health. I don't know if you know it, but chronic stress is a precursor. I say this all the time, don't I, Winnie? Chronic stress is a precursor to mental illness, right? And you don't have to answer, how many of you are dealing with chronic stress? Don't answer. Don't tell on yourself, but I already know. If you work in public schools, you are dealing with chronic stress. Some of you are handling it better than others, but it's out there. So we want to make sure we support you, because not only mental illness, but also physical illness. Diabetes starts with unmanaged chronic stress, right? Hypertension starts with unmanaged chronic stress. So use these services, these resources we have for you. Able to is another way of providing mental health support with a therapist. There's a licensed therapist. However, different from the random appointment, they create a plan, an 8-week plan, and it's digitally done as well. So check that out. Able to, for you or your family member. Blue 365. You asked me if we have a gym discount. We do. Just like everybody else, we have a gym discount available, as well as some other resources. Go to Blue 365 and register. And I'm using this. Let me tell you my experience. I registered. I live in this area. You go in, you register, a locator comes up. I put my zip code in, and what'll come up is all the gyms in my area and different price points. Okay, it's like 3 levels. So I chose the mid-level, and it's $29.99. The core level is $19.99. I chose the $29.99. And this is valuable to me because I have access to like 5 gyms in this area. And you might be thinking, what do you need access for 5 gyms? Well, I got friends everywhere, and I like to work out with them. So I have, on my keychain, I have 5 memberships. I work out at this place called, I don't want to give them too much credit because I don't get any kickbacks for it, but I work out at this place called Fit Stop 24/7. It's like 5 minutes from the house. My husband works out at this place near here. It's called Powerhouse. Well, sometimes we work out together. So I can go to Powerhouse. I have a membership because of this. Or I can go to Fit Stop 24/7 right by my house. Or I got a couple of friends that I used to compete with back in the day. I used to compete as a bodybuilder. They work out at Conquest in DeWitt. I can go check them out or do the classes out there with them I don't pay any extra for these gyms. I'm a member to all these gyms. You can do that too. So, and if I choose, say for instance, I'm traveling, I go in there and I put the zip code in. You know, sometimes when I travel, I just use a hotel gym. But sometimes I like to venture off into the gyms in the area. If I'm out of town, I can put that locator and there's gyms in that area I can go to and I'm already paid up for them, right? Additionally, you have access to this uh, on-demand fitness. It's called Burn Along, right? So I can access this. There's videos on Pilates, there's boot camps, there's an ab camp, there's different types of exercise modalities at different durations, right? In their video, they look live. I call them an on-demand type. But now this is something you can do. Let's say you're a part of this, you did this because you like going to gyms and this is a good deal. You don't have to do the gym to get this part. You know, some people are asking me about how can I start an exercise program at my school? Well, let's go back to the big screen in the break room. You can pull this up in the big screen in the break room, get your girls, get your guys, everybody meet at 12:30 and let's do Pilates. It's right there for you, okay? Or let's do this 15-minute ab workout. That's your motivation. I just read a Facebook post the other day that says motivation doesn't come before action, right? You got to move first. Go get into the lunchroom and pull it up on the screen and then start doing it. And then your body starts releasing dopamine. And now you feel like doing it. Don't wait till you feel like it. Just do it. And that's how you produce dopamine. I guarantee you, if it doesn't work like that, you email me. Digital tools. We have an app, a MESSA app. Some of you already have it because you are app people. So if you are in that digital world and you like things on your phone and you have enough space, download our app. Everything is accessible from the app, okay? And go to mymesa.org. If you have the health equity, health savings account, everything you can get on My MESSA. And that's the app right there. And there's our socials. How much time do I have? Okay, let's talk about some of these resources because I want you to think about how can I incorporate these MESSA resources into a worksite wellness. You know, worksite wellness is about creating a worksite that supports health and wellness. Most worksites do a very good job at supporting stress and distress, right? Sickness. So we want to find a way to transform the culture, okay? You are now considered behavior change specialists, wellness pros. If you stayed this long into the presentation, you bought in, you're going to get a certificate at the end of this, right? You are now the wellness pro for your district. So some things you can do. Health risk assessment, health interest survey, wellness report card. These are some things that can help you survey your potential, your target population, your audience, the people you think you want to participate in a worksite wellness program. Now, you don't have to survey. I always say this. This is just doing it by the book. I can tell you right now what you have in your population. You have stressed people. You have a bunch of stressed people that are struggling to move enough, maybe not at the elementary school level, but I can say movement that is mindful is hard, even when you're moving around, okay? Movement that is restorative is difficult. Just because you're moving, it doesn't mean it's the type of movement that brings health mentally and physically. You have people that are struggling to make good nutrition choices, food choices. You have people struggling to sleep. So if you didn't do a survey at all, you know that for sure, because I'm telling you. But a survey often gives us facts, right? And if you're working, let's say you're working for your superintendent has given you assignment to start some type of worksite program, and we need data, and you need to measure before and after, a survey is the way you want to go, and this will help. Our health risk assessment, you find that at our My MESSA, okay? Same place as the My Stress tools. What this does for you personally, if you're here to start your own personal wellness journey and see how MESSA can help you, the health risk assessment takes about 15, 20 minutes. You answer questions about your lifestyle. It's kept private. I can't even see the answers, right? And what you get immediate feedback on your risk, your health risks for over 60 health conditions. So it basically tells you you're not walking enough, you're at risk for metabolic conditions, cardiovascular conditions. So in the world of health promotion theory, this kickstarts people from, we call it pre-contemplation, where you don't think anything's wrong, at least into contemplation, right? If there's a theory of stages of change, if you know the stages of change and your people are in pre-contemplation, they have no idea they're sick. This can help them. They have no idea they're at risk for diabetes or high blood pressure or disability. This is where you want to start, because this is going to put it right in their face. And they're like, what? So now they can contemplate the journey, right? They're contemplating the journey. Meanwhile, you're building it. So as soon as you send out the information about the walking challenge, you're going to help move them from contemplation to preparation and potentially action. So this is great for starting the year off. You know, everybody, January here always puts people into a preparation phase, and this can help move them right into action. Health interest survey. Now, the health risk assessment, the tool I just shown you, is exclusively for MESSA member, the employed person. Health interest survey is for everybody. So it doesn't matter if they have the health plan or not. Health interest survey is for everybody, and it's to get their opinion on what they want to do. We want to do things that people want to do, so they'll do it. We want them to show up. If I sit on a committee and spend an hour, hour and a half every other week, and I build a room and buy the food, I want to make sure there's people coming, at least 30% of my population. So if I ask them what they want to do, it's more likely that they'll show up. So that's what the health interest survey, and you can find that on our website if you're interested. And it's open to the public. You can use this just to inspire ideas. I always encourage wellness teams, wellness committees, wellness liaisons. You may customize this to your environment. You might want to add in there are there any Zumba instructors? Because you want to start live exercise classes. I can guarantee you, especially big districts, ISD, there's somebody in there that has that skill, Zumba, yoga, boot camp, that wants to share it with you. That's how you find out. And they might want to contribute their skill. So make sure you put things in there that you have and that you need, right? So customize it to your environment. Wellness report card. This is specifically for MESSA members. This is great for individuals that have been assigned a project of starting a wellness program from a higher up, like a superintendent, human resources, and you need outcomes, right? So you need to start with something. This can give you information on how your population is utilizing healthcare, specifically preventive care services. So you start with this, and then you run your program, your interventions, your activities, and then perhaps a year, 18 months after, once the claims come in, you can compare the pre to the post and give evidence that, okay, when we started, no one was getting their wellness exam, or only 20% of the people were getting their wellness exam. But now, after we did the health and wellness newsletter and sent messaging, after we did the lunch and learn, after we did this activity, 80% of the people are doing it. So you can show the power of your interventions by starting with the wellness report card, ending with the wellness report card. Let's talk about other resources we have. All of this is on our website. Okay. There's a toolkit there. It has our philosophy about wellness, mindfulness, movement, and nutrition. I try to make it very easy. If you don't decide to do a survey, let's say you don't survey your audience, think mindfulness, movement, nutrition. You're sitting at the wellness committee table trying to plan. What do we do? How do I help these people? Mindfulness, movement, nutrition. Mindfulness, it'll address the stress, right? Getting people to think about the moment. Movement, activities that inspire movement. You start with awareness, give some statistics, then lead into opportunities, right? And all within movement, there's also absence of movement. Sleep is so important. I do a session just on sleep. And then nutrition. And there's some examples, some ways you can do some of the activities at your location. And I am your toolkit as well. If you need help, you can always reach out to me. A monthly activity calendar. You can use this when planning activities, if you like. I always tell people, and this is how our wellness teams usually operate. You sit down at the table, start planning, you pull out your calendar. You have your school calendar. If you want to, the easier way to do it is pull out another calendar that looks just like your school calendar and start plugging in dates. You already know the dates you can't do things, so plug in dates. And you know what is always helpful is knowing the national theme. There's always something nationally health theme every month. Like this month is Menopause Awareness Month. I believe November, we get into diabetes awareness. So you can use the national campaigns to help push your campaign through. And the beauty of that is if you go to those websites, the websites of those organizations, you can get flyers already vetted. You can get information from American Diabetes Association. February is Heart Month. So the American Heart Association, they have campaigns already built. So instead of using up a lot of energy to try to think of something, you can go there and borrow some ideas. You're not stealing them. They want you to use them. So you can go there. That's why they do it. They want us to use their ideas. So those are some ways you can get campaign ideas. You can go to our website and we have some we use there. So mindfulness, movement, nutrition, and connection. Somebody added that. We're going to talk about nutrition, connection as well. You know, worksite wellness connects people. I tell everybody, if you're having an issue, and often that happens when people are stressed, they tend to isolate. And isolation is also one of those visible symptoms of potential mental distress. So worksite wellness can help connect people. And I found doing this, going out to schools, especially the walking challenges, and school employees love to compete. They're the most competitive people I've met. But let's talk about mindfulness, some things you can do for mindfulness. Okay, this can help you. Some ideas you can do just with your department. You can do with your whole district, your building, if you want to start with your building, if you want to start with your association. Mindfulness, write it, doing a group journaling activity. I mentioned it before with the My Stress tools, make it easy. The only problem with that is everybody doesn't have access to My Stress tools, only your MESSA members, but just going in there and doing a mindfulness coach can help. Mindful Monday email. If you're the only one pushing this, and often that's the situation, creating an email that everybody's looking for on Monday to set the tone. And it could be one tip about mindfulness. It could be instructions on how to do some breathing. It could be one word. It could be exhale, right? Just reminding people, because when we're busy, especially on Monday, our minds are going. We've been thinking about Monday since Sunday night, right? So just a gentle reminder to exhale. It's going to be all right for the rest of the week. Can set the tone for the week. Gratitude. Thank you. Gratitude. One of my favorite mindfulness practices. There's a lot of research on being thankful, on practicing appreciation, right? And it's very powerful in students and well, in children, school age, because it just changes the terrain of the brain. You can't be negative and thankful at the same time. And you know, I always tell people your brain is neuroplastic. It's plastic, it changes based on our thoughts and our behavior, right? So a lot of us, and I even admit, I'll be transparent myself, I've built a very critical brain as a nurse because I have to, when I was educated as a nurse and during my hospital years, I had to be able to walk in a room and think critically to save that person's life. So it's kind of a negativity bias. I had to look for the negative. Uh, I had to make sure that I could see what's going on to save the patient's life, and that shapes your brain. So I have to be intentional about reshaping my brain, and gratitude practice helps us with that. So things like including that in an agenda on a meeting, giving people an opportunity to appreciate someone or something. I appreciate the people in this room right now that are helping me, as well as this platform. I have a great team that helps me put this wellness conference on. I'm so thankful for that. Simple things like that. What I just did, what I just said, just caused serotonin to be released. So I'm feeling good right now just saying it. I'm smiling and I'm looking at them. They smiling at me. So it's reciprocal. So I just did this magic. They just sitting up giggling in this room. I'm telling you, you can do it at work too in a meeting. Say something nice, something positive. Fill somebody's bucket in your room. You can boost their immune system. You can boost their productivity. You can help them out of a rut. 30-day resiliency program. That is in the My Stress tools. Reach out to me if you need some ideas for mindfulness. Movement. I can't say enough about exercise. I've been reading so much research. You know, when you move your muscles, I got to say this. They telling me I don't have a lot of time. I only have how much time? How is that? Okay, when you move your muscle, they're doing more research on this. So there are what we call myokines released every time your muscle contracts. Everybody squeeze a muscle right now. You don't have to tell me what muscle you're squeezing. But when you squeeze a muscle, there's myokines released. It's an isometric movement right now, okay? Myokines, they also call them hope molecules. And they do just what that says. They make you feel more hopeful. They minimize the pessimism and the negativity and make you feel more hopeful. Doesn't that make sense? But because we know research says that people that operate in fitness, or people that engage in fitness, or people that engage in exercise are more resilient. That makes so much sense, right? Because they exercise, they're contracting their muscles, they're releasing myokines. And this is what the most recent research. Exercise can change how your brain processes past trauma. So if you've been through, and we all have probably been through some traumatic experiences, some hurtful, no matter what it is, exercise kind of smooths it out. So when you think about it, it doesn't hurt as bad. This is what the science is saying. So again, that contributes to the thought about the resilience. It builds mental and physical resilience, not only for those type of things, those mental, emotional, but even your immune system. People that have more muscle are more likely to have a greater survival rate if they're diagnosed with cancer. Also, exercise that creates muscle. Muscle is an endocrine organ. So when we're in the stage that, or we're fighting perhaps diabetes, we've heard the term prediabetes or insulin resistance, muscle can help use up some of that glucose. It's a glucose disposal cell. So extra, let's get people moving on the job, not just moving, stressed out moving, but more mindful, restorative, therapeutic movement where we know why we're moving, right? Walking is always a good thing. And the challenges bring camaraderie, community. People love to compete. Push-up challenges, group exercise. Remember what I said about the Blue 365 videos? Create a fitness directory. and do some things. Nutrition. I could talk all day about nutrition too. I love it. I love it. I love it. It's so much. I would even risk to say nutrition is probably the most important because the nutrition from the food is what helps our body function, right? Function like it should. So, meal plans, salad jar lunches, recipes, newsletters with healthy recipes can be helpful. And connection, very, very important. We have chemistry, right? There's a chemical called oxytocin that's released when we are around people that we like being around, right? And there is, especially during happy situations, oxytocin is released. It makes you feel good. So you want to create opportunities during the workday for people to gather together and have fun, right? It creates health for those people within your work site. And listen, I'm starting back MESSA Wellness Pros. Our first session is coming up soon. I want to say November. And there is a healthy cooking demo. We'll be sending out the recipe, and somebody correct me if I'm wrong in the chat. If it's no, it's definitely November. The third Wednesday in November, we'll be sending out a healthy recipe, so you can cook along. So that's what we're doing this time. We're bringing back Vicki. She was with us in the spring. We'll share her recipe so you can go get the stuff and you can set yourself up in the kitchen, and we're all going to cook together. Register. That's coming to you soon. Registration for Wellness Pros. I appreciate you here today. If you have any questions for me, go right ahead and ask them while we'll get ready for our next presenter. I believe I saw her in the house. Any questions in the chat for me? What's the questions? 30-day resilience. It's at mystress.com, but you go through mymesa.org. Okay. I need you to go ahead. If you haven't been to mymesa.org, I want you to go there because you have to create credentials. And it's good to know about your personal account. Go there, go to the top. It'll say My Stress Tools under other health resources. And you go to the site. Okay. In the site, there's one of those little, what do they call them? Cheeseburgers, hamburgers at the top. Hamburger on the right. Click on that and you'll see all the activities, okay? And then the resilience challenge is right there. Check it out. And you can see how you want to do it. Reach out to me and let's talk about it if you want to. You can reach me at rjones@mesa.org. If you're thinking about doing it yourself, you can see it. Or doing it with a group, I have a couple ideas how you can do that. I can help you with that. 7, I have one. The mindfulness coaches in mystress.com. If you need a 7-day challenge, I created one. Email me at rjones@mesa.org and I'll send it to you. Does MESA cover nutritional coaching? No, we do not. No health plan does. Now, remember the teledoc. If your nutritional coaching is for weight management or weight loss, teledoc has the weight management program. If your nutritional coaching is because you are at risk for diabetes or you have diabetes, teledoc has coaching for that. Now, MESA does cover a registered dietitian for medical conditions, okay? And what I would encourage you to do is contact your MESA field rep with your specific questions or our member support program with your specific questions.